Hello, my name is Egma Aranea. I study nursing and I am in the seventh cycle of my career. I go to talk about the Paris Oculoglandular syndrome in the cat scrap disease. Definition: this syndrome is caused by an infection with gram-negative bacteria, virus, fungus, or parasite. The most common causes are cat scrap disease and tularemia rabbit fever. The bacteria can cause either of these two conditions can infect the eyes. The infection is transmitted to humans through a rabbit or scratch. The cat flea transmitted the infection between cats are may be the cause of disease in humans who have not had contact with cats. Almost the disease theories in the improved children are the most affected.
As cat scratch fever, but cat scratch disease is an infection caused by the intracellular bacteria known as Bartonella henselae, which is a gram-negative bacteria. Here is an image of that bacteria. Now, this is why this disease can be referred to as Bartonellosis because of an infection with Bartonella. Now, cat scratch disease, as its name implies, is that it is cat to human transmission. That means that we can get cat scratch disease from a cat through a scratch or a bite. Now, cats are the natural reservoirs for Bartonella henselae, but fleas are actually a vector of transmission. So fleas can actually pass Bartonella henselae from cat to cat. So if our cat is an indoor cat that has never been outside, that's never been exposed to fleas, it's less likely to carry this bacteria. Now, when a human does get infected with Bartonella henselae through a cat scratch or a cat bite, that bacteria, the Bartonella henselae, will invade the endothelial cells in that person. It will lead to an acute inflammatory reaction. It leads to the activation of a pro-inflammatory cascade, which will cause some of the symptoms we're going to talk about in the next slide. So what is the clinical presentation of cat scratch disease? One of the biggest ones is a skin lesion. This makes sense. If we get bit by a cat or scratched by a cat, there's a lesion, but there's a particular lesion with cat scratch disease, and it occurs generally 3 to 10 days after inoculation of the bacteria. It leads to a vesicular or an erythematous or a papular lesion, and this lesion will stick around for about 1 to 3 weeks. The lesion looks like this. So in these pictures we see possible cat scratch here, and we get these little papular type lesions. This is the characteristic look of the skin lesion in cat scratch disease. Now, another big symptom that we see in cat scratch disease that usually is the defining symptom in this disease is regional lymphadenopathy. This usually occurs 2 weeks post-inoculation. So after about 2 weeks after the individual has been inoculated with the bacteria, we start to see this regional lymphadenopathy. It is proximal to the inoculation, and it is tender. So we generally, if a cat scratch or bite occurs in the arm, we can see this tender proximal lymphadenopathy, usually in the axillary nodes. So we can see in this picture here that we get this tender lymphadenopathy, axillary nodes, proximal to the inoculation. So this is a key presentation in cat scratch disease as well. And the third most common symptom is a fever. That's why cat scratch disease is considered a febrile lymphadenopathy, fever with regional lymphadenopathy. And if you see an unexplained fever in an individual, perhaps they have cats, think about this as a possible cause. Now, other than these 3 most common signs and symptoms, there's also certain instances where individuals can have a disseminated disease, a disseminated cat scratch disease, and is unsure about the pathology or the pathophysiology as to why this happens, but a subset of patients can get dissemination of their cat scratch disease. It can lead to hepatosplenomegaly, so an enlargement of their spleen and enlargement of their liver. They can get retinitis, an inflammation of the retina in their eyes, and they can also get encephalopathy. So again, this occurs in rare instances, but it can be caused by cat scratch disease. There can be a dissemination of the cat scratch illness. But generally, in most cases, and most often, it is a self-limiting disease. So generally, patients only get skin lesions, regional lymphadenopathy, and fever, and it often is a self-limiting disease. So how do we diagnose and treat cat scratch disease? Diagnosis involves serology. We look at IgM and IgG levels. IgM and IgG serology has low sensitivity but a high specificity. So if we see IgM or IgG antibodies to Bartonella henselae, we can affirm that they have a diagnosis of Bartonellosis or a diagnosis of cat scratch disease. PCR can also be performed to look at DNA or genetics involving B. henselae. Lymph node biopsy can also be performed, although this is generally not required, just because if we can see the history and get good serology and a possible PCR, we may be able to make the diagnosis. Treatment is generally supportive. Oftentimes, this is a self-limiting disease. We often leave it. We provide supportive treatment. However, if there's lymphadenitis, so if we get lymphadenopathy, if it's a moderate to severe, if the patient's very ill, or if the patient is immunodeficient, we want to treat this. We want to treat it with azithromycin for 10 to 14 days. And if this is a disseminated disease, if it's a severe case of disseminated disease of cat scratch disease, we want to give azithromycin or doxycycline with rifampin. So that's the only difference. We add rifampin or we use doxycycline and rifampin for disseminated disease. So anyways, guys, I hope you found this lesson helpful. That was a lesson on cat scratch disease. If you found this lesson helpful, please like and subscribe for more videos like this one. And as always, thank you so much for watching, and I'll see you next time.
Okay, continue. Application in nursing. Nursing care of this type of patient is to place cold or hot compress of water or hot towels. Placement of medicine according to the medical prescription restricting the care. This is analgesic and sometimes antibiotics in immunocompromised patients.
So this handsome young man here is going to teach us a little bit about cat scratch disease and Parinaud oculoglandular syndrome. And I have with me a younger, better-looking doctor than me, but we're going to be talking a little bit about the cat scratch disease. So show us where you got the cat scratch. And that was, I think, like on Tuesday, if I remember right, right?
Yeah, yesterday or today? No, because that was yesterday.
2 days ago. Got it. All right, good. And then you started to get some swelling in your neck. Show us on your neck where the swelling is.
Right here.
Yeah, right there. And actually, when we feel on it, Yeah, we can feel it. We can when we actually feel on it. It's definitely swollen. And then when I push right here, you got like a big swelling right there, and that hurts you, right? Yeah, that hurts. That's preauricular swelling. And then about the same time, your eyes started to get infected and red.
Can you look at that wall over there?
Yeah.
And then look at me with your eye? Yeah.
And then let's see the conjunctiva of the lower eyelid. You just flip that down there. Yeah. Yeah, look at that. Nice and red. So, Ashton, would you do a little teaching on us as to what's going on here?
So basically, you get cat scratch disease by getting a scratch from a cat.
Yeah.
All right, and so basically, it's a bacteria called Bartonella henselae that can get into the bloodstream and cause some lymphadenopathy, where we see the swelling of his preauricular lymph nodes, as well as he has some posterior cervical.
And he actually has a lymph node down under here too. He's got a submandibular node too. And so, what about the Parinaud ocular glandular syndrome though? That's kind of special. I mean, I haven't seen that for forever.
Correct. So basically, you can get redding or conjunctivitis of the eye from the bacteria.
And it can have some purulent drainage
correct,
from
as
the eye.
He has.
Yeah, you can see some crusting in that eye.
Correct. Yeah, and so a lot of the times it's transmitted from you actually touching the scratch part of the skin and actually touching your eye.
Yeah, so you can actually transmit it, or
correct.
the cat could lick your eye.
Correct. Yes.
Yeah, or the cat could scratch your eye too.
Yes.
Does your eye hurt? A little bit. Okay, all right, but definitely you definitely have some swelling here. And because we can actually, I think we might be able to see that with the camera. Yeah, actually, you can see it with the camera. And then, and you definitely can have. I can feel just like a big node, like sitting right. Yeah, I can feel like a big area of swelling, like right there on your head. So, well, you know what? I am so proud of you, and I want to thank you and your mom for letting us do this. Because you're going to teach doctors and nurses all about this disease. Is that good?
This will be on YouTube, ain't it?
Yeah, you're gonna be on YouTube. Yeah.
Yeah, I got
You're gonna be a
YouTube.
YouTube rock star. Yeah, man.
Yeah, I'm like YouTube a lot, don't I, Mama?
Yeah.
I don't even like it.
You can help people. Yeah.
Okay, continue. Pros and cons. Pros. Generally, cat stripe disease is not serious. It, in most cases, you don't need medical treatment. Cons. In the people with HIV, AIDS, and others who have a weakened immune system, can stripe disease is a more serious antibiotic treatment is recommended. Have allergic lymph nodes. In Swiss, in a plague in Ecuador. Bartholomew changed various antibiotics in the Captain and the fever place in high normality epidemic. The life of the patient depends on IgO medication, tetracyclines, chloroplenicol, especially when they are in current infection. Sulfa and macrolizine generally have given good results. In our countries, in adults, we have treatment with trimetoprim, sulfatamide every hours or 15 and 20 days, treatments, doses every 2 hours for 10 or 20 days, and members treated sulfamethoxazole at 30 milligrams. Conclusion: epidemiology is important in this diagnostic science. The clinic's picture can vary in immunocompromised patients and in older people, so a serological study and instapolling are necessary for this confirmation. The therapy with macrolide means azithromycin is high effect. Thank you.